Hello, this is Dr. Lewerenz, the Longevity Health Institute. Hope this finds you well. So, hey, apologize for some of the absence. I've done a video in a little while, but here's why. Is just I've been, humping it here at the office, helping people and trying to do always the right thing and bring you good health and wellness and prevention with me and my practitioners here. So, give you a little clinical update here just real quick. Doing real good stuff here in Rochester Hills. Still have our office in Madison Heights. We are opening a office on 12 Mile and 14 in Bloomfield. And our plan is in early 2022, we will have a location with a doctor that's joining us and another nurse practitioner in Grosse Pointe, just to keep you up to speed with what's going on. So Longevity Health Institute, we're spreading our wings, really bringing the whole metro area the best in functional, regenerative, personalized medicine, and integrating the best of, traditional approaches, advanced wellness approaches, and holistic and lifestyle approaches. So we integrate those two. So follow me here on YouTube, Facebook, etc. Emails us with any questions or like that. But here's today what I want to talk to you about, somewhat related to COVID and any virus, and somewhat related to your immune system, but very real stuff that we see here all the time. And for whatever reason, I've seen here more the last month, and why I wanted to bring this to you, and I haven't done a little talk on this. And this is viruses, in general, viral exposure, and what happens and why some people get more of a viral load and an infection and a more hit with, if you will, and sicker, and even show up and potentially develop into cancers. And I'll explain that in a second. But viruses are everywhere, not just COVID-19. Okay, we see here shingles all the time. We see herpes all the time. We see HPV all the time. We diagnose Epstein-Barr all the time, cytomegalovirus. There is a bunch of viruses. And right now, of course, every day, at least a couple we're handling, our own patients and referrals for taking care of COVID-19 long haulers, meaning people that have at least 3 to 6 months of some lingering symptom post COVID-19, SARS-2, because there's this post-viral inflammatory response. So let me go back to basics. Our systems approach, we never forget. We always want to concentrate on it. I want you to at home, even if you're not my patient, or you're seeing somebody in another state, even though we do take care of patients around the country and help them and guide them. But I do want you to know is at least address these, think about these, have your practitioner look into these, and don't accept that these are just nothing, or they're okay, or they're average and you're fine, okay? System-wise, to fight any virus, you have to have a good adrenal system. You have to have a good gut and good diet. That means, when I say gut, I mean not just that you don't have a upset stomach or diarrhea or food intolerance or allergy. I mean any time of you get heartburn, or you might bloat, or you have to avoid a certain food. Or if you have a good doctor, they'll look into your gut health, your gut flora, maybe look at your blood, maybe do a stool sample, maybe do a food allergy test or what's ever appropriate. But the point being is that you have to have a good gut. That is 70% of your immune response, if not more. But what's really important is your gut barrier, these peptide bonds that bind between your epithelial cells in your digestive lining. So it's not just really about probiotics and, eating the right food. That is true, but you have to have a good, sound digestive barrier. Otherwise, you're getting constant immune insults, okay? So then when you get this viral exposure, whatever it is, okay? I have a good friend that has unfortunately developed oral pharyngeal cancer from HPV, human papillomavirus. We're seeing higher and higher rates of viral infections causing cancer. He has developed oral pharyngeal cancer. Head and neck cancer is the 5th leading cause of cancer in the country and growing. And we have to recognize that these viruses out there are real, and they're not just a one and done, or they come and go, or don't worry about it, it's no big deal. You have to build a good, sound immune system at the gut, at the adrenal system, okay? And with the right lifestyle, okay? And understand these viruses, and also just simply be tested. You only know what you know. If you put your head in the ground and ignore things, or say, well, that's not really, everybody's got Epstein-Barr, or everybody's got herpes, which is true. 1 in 4 people have herpes. We actually suspect that even more than that have a form of HPV. Not all HPV will cause cancer, but we know that it's becoming one of the leading risks to head and neck cancer. And we know already that it's becoming a big risk, or it is a big, risk to cervical cancer in women. So again, you have to be aware of these. Now, what do these viruses also do? And they're becoming more popular, not in vogue popular, but more and more prevalent. And that is like shingles, for instance. It hits you, and it hits somebody that has a weaker immune system, okay? Gut, adrenals, hormones, nutrients, diet, lifestyle. When your systems are off, okay, then these viruses take more hold in you. And one of the things I want you to be a little bit aware of too is that your sex hormones in some of these viruses, like shingles, like chronic herpes recurrence, okay, sometimes like an HPV, have to do with your sex hormones. Because when your sex hormones are imbalanced, like in a perimenopausal woman or in a menopausal woman in their mid-50s, and yes, they're potentially not menstruating or cycling, but their hormones are still adjusting and swinging a bit, or a man that is going through andropause, or a woman or a man that's going through adrenal dysfunction, so they're not producing enough appropriate balanced cortisol, or just because age decline, they're not making enough DHEA. Anyway, long story short is this, is that they are having these immune swings due to sex hormones. It's very related. I see it here all the time. My practitioners and me talk about this all the time. We'll have somebody that is perimenopausal and gets her herpes flares right before her cycle. Why would you get herpes chronically over and over monthly, or have an outbreak, or need to take Valtrex or acyclovir or an antiviral because of herpes? Genital or oral, so type 1 or type 2, doesn't matter, all the same thing, is because this sex hormone immune shift that actually happens every month. And in a man, like I said, it can happen to low testosterone or adrenally, and a woman monthly because of cycling her sex hormones. So these have to be addressed in somebody that has chronic. You can't get rid of herpes, technically. Can't get rid of shingles virus, the varicella virus, technically. You can't fully get rid of COVID-19 fully, okay, because you'll develop it resistant in your body. You'll develop antibodies and B cells, etc. And you'll have some innate protection once you're exposed. But the problem is when there's an immune shift, it can rear its head. Okay, when it rears its head, we suffer neurologically, inflammatory-wise, etc. Now, so again, what do you have to do? 1 is prevention, building a strong immunity in the foundation. 2 is making sure that you get thoroughly looked at and tested. And just right now, we just started screening people, not just for HPV cervically, but we're starting to screen them for oral pharyngally with a swab. May sound silly, but it's very low percentage. But if there's a chance there, we can even use things like water-soluble silver. We can use ozone, besides building a good digestive floral system and a good integrity in the gut lining. And that can then get rid of HPV, okay, and get rid of these nasty viruses. We do have protocols to get rid of viruses, and they're very successful. But the start of treating any infection, okay, is building a good immune foundation, not just targeting the virus, because the virus will keep coming back. Once your immunity is low, the virus will just keep coming back, okay? So the take-home message is this: be aware that it's very common and potentially normal, but not good, that you have viral exposures like herpes, HPV, shingles, varicella, Epstein-Barr, which causes chronic fatigue, and mono, cytomegalovirus that causes chronic fatigue. These viruses can actually, just like COVID-19, and there's more than 20 coronaviruses that cause common coughs and colds, they can cause some immune hits to us that then are responsible for other immune insults and potentially like a cancer, or sometimes we think even like an autoimmune response. So make sure your systems are good. We always have a 6-point model of a good health foundation. We always consider genetics, your hormonal balance, your digestive flora and digestive lining, your gut health, how you detoxifying toxins, your mind body, so meaning your where your mind state is, so your mind and body connection, your autonomic nervous system, and structurally what's going on with you in pain, okay? 6-point model that creates prevention, health, and wellness, and getting rid of then and stabilizing any nasty virus that can then take chronic long hold on you. So share this with others, because there is help out there, not just viral suppression therapies, to prevent and treat these things, and so that you either don't get them or that you can thrive from these and beat them and survive and not suffer chronically and potentially even monthly and daily and weekly. This is Dr. Lewerenz, Longevity Health Institute. Please share with others. Follow us on YouTube and Facebook. We're open for new patients all the time. As I add practitioners, we can actually provide you still more and more best in functional health and wellness and personalized medicine. Happy to see you. Rochester Hills, Bloomfield, Madison Heights still, and soon to be Grosse Pointe. Be well, Dr. Lewerenz.